Hi and welcome to this Wound Hygiene Bite-sized podcast. My name's Shelley Hawkins, Strategic Customer Engagement Manager at Convatec. For this bite-sized series, we'll be talking about wound hygiene, a 4-step protocol of care that anyone can do. Today, I'm joined by Laura Hollins. Laura, would you like to introduce yourself?
Hi, I'm Laura Hollins and I'm a tissue viability specialist nurse at the Royal Wolverhampton NHS Trust, covering both the community and the acute.
Thanks, Laura. Can you start by telling us how you first heard about wound hygiene?
So I luckily met Danielle in 2024. We questioned her a lot on the wound hygiene 4-step approach and the more than silver technology. She came back with all of our research and then she said, come to a wound hygiene masterclass. So went to one in Oxford in 2024 and that's where it all kicked off from there.
Fantastic. And Danny is your healthcare development manager for Convatec.
Yes.
So can you tell us about the evidence that you've been gathering to support your use of wound hygiene?
Yep. So I came back from the wound hygiene event very, very excited. Wound hygiene wasn't really that welcomed in our area. So to get something really onto our formulary and our pathways, we have to gather quite a lot of evidence. So Convatec have really, really helped us with critiquing evidence. So I've attended a few events with Convatec where we've sat down and we've really been able to critique evidence, look at slogans, how was research conducted by other companies, and look at other companies' approach to wound hygiene.
And so how have you used that evidence in discussing wound hygiene with your colleagues?
So it's been a tough one. It's not been an easy one. So we've used the evidence to really back up the more than silver technology, try to myth bust a lot we did once tell our colleagues that we don't clean wounds because of the cellular matrix that's on there. We don't want to disturb that. So it's really been taking it right the way back, using the research to show that actually the 4 process is really working. Luckily, we're starting to do a few case studies now, so we're getting the evidence to show it as well as having the research to back us.
So in exploring the evidence for wound hygiene, which parts have been most valuable to you?
So whilst attending a masterclass, we met Dan Metcalf from Convatec and we looked at the confocal microscope technology, and it was really, really beneficial to see how a biofilm is, how you've got the different multi-organ species working together, how you've got the anaerobic and the aerobic in the EPS, and how by using the more than silver technology and the wound hygiene, how that can reduce over time, even by reinfecting it. Yeah. We still get that continued reduction of biofilm, and then we can eventually get onto the bacteria and eradicate them.
Yeah, that's fantastic. It's there's some really good data in there comparing the different technologies and how they're able to reduce that EPS structure. Okay, so what results have you seen with wound hygiene? So
we're trying to myth bust the 2-week use because it's very big in our trust. Mm-hmm. So we have been using silver for slightly longer, in some cases a lot longer, 8 weeks, and we've nearly healed wounds because some wounds have been really stuck in that chronic inflammation stage. And even when we have got some granulation tissue present, it's not been the healthy granulation tissue that we would like. So using the silver for more than 2 weeks has really got on top of that biofilm, and then we were ready to step down. But we have a look at the wound every 2 weeks, take some clinical pictures, have a little assessment between us if we're not quite sure to carry on, and then it's appropriate use of silver.
And you've been seeing really good results with that?
Amazing results.
What outcomes have you seen in introducing wound hygiene in your area?
So we're having to do a QI project in our area to really try and get things off the ground. So we're in the very early stages at the minute. But whilst doing it, I have managed to capture Fracture Clinic in our area, who are, luckily for me, really, really excited about the project. So we've got from the initial data that we're not being very uniformed. Not all of us are practicing the same. We're using different dressings. We're cleaning with different solutions. Some of us clean it like we mean it. Some of us don't. So we've managed to get a uniformed approach where all practitioners now are following the same 4 steps. We have to combine 2 of the steps because we're not allowed any debridement cloths, so we're just allowed saline and gauze or Pronsan and gauze. Mm-hmm. So we use cleanse and debride as a 1.
Okay.
But we've combined it to 3 steps, so we've got those 3 steps now. It's a uniformed approach, and we've seen so many clinical outcomes now. So we've healed wounds in less than 2 weeks that were going on for sometimes 3 or 4 months.
That's fantastic.
Yeah. And I've got a really good case study also going on of a Morel Lavalley injury that was potentially going to go to plastics, and now we're not going to have to go to plastics.
Okay, that's amazing. Fantastic results. So we've had 2 new publications in recent months. We've seen the NICE LSA come out for antimicrobials, and also we've had a randomised controlled trial published this year. How will that affect how you present wound hygiene to your colleagues?
So the LSA wasn't greatly beneficial because we've gone down to it's clinician's choice, but hopefully it's got us talking about the clinical effectiveness of our products along with spend. It was really helpful to see that Aquacel AG plus Extra has been grouped on its own because of the more than silver technology. So hopefully it's going to question our spend, but then is spending more initially going to cut down our healing times, which is then going to reduce spends.
Fantastic. So Laura, there's a bit of a myth going around that using silvers will drive antimicrobial resistance. Have you seen any evidence of that?
No, and we have really tried to look everywhere for this evidence, because that is something that we are battling with each other amongst my peers and managers. So I haven't actually found anywhere for silver resistance. There is a lot about antimicrobial resistance, but a lot of the research I've read is down to antibiotics rather than antimicrobials. There's obviously a big push at the minute for more natural, non-active ingredient products, but actually we haven't seen the same results that we have got with the more than silver technology.
That's really interesting. Thank you. Thank you, Laura, for joining us. That's it for this podcast series. We hope we will see you on the next one.